We've been talking about angina pectoris. We spoke about stable angina, unstable angina, so many things. All right. So it's now good for us to now, as we are spoken about the disease condition, it's not good for us to leave without talking about the treatment because this disease condition is kind of like treated. So we will look at the anti-anginal therapy for acute coronary syndrome. So for the anti-anginal therapy, it's basically some drugs that could help us. Is it relaxing the heart, the blood vessels? Is it trying to eat off the clot? Okay, is it so many things? Okay, so many ways in trying to correct this acute coronary syndrome can be done by these anti-anginal drugs. So let's look at them so that you guys could basically have an idea. We've spoken about acute coronary syndrome. It's like caused mostly by a deposition of fat on the walls of the blood vessel, right? So for the goal of treatment, the primary goal of you treating anti-anginal therapy for acute coronary syndrome is to what? Relieve the pain that the patient is feeling. And the patient will mostly feel chest pain. That's angina, right? It's reduce myocardial. Okay, you are trying to reduce the way the heart muscles are demanding for oxygen because oxygen supply is reduced. Do you understand? So you don't want the heart muscles to continue demanding for oxygen like they used to. Do you understand? So you want to reduce the way they demand for oxygen. So the common anti-anginal medications for acute coronary syndrome include things like nitrates, like nitroglycerin. It could be sublingual, it could be oral, it could be IV. We have the isosobide mononitrate. This one is given oral. You could introduce beta blockers to the patient where you are giving drugs like what metoprolol, atenolol, and propranolol, which could be oral. Okay. Then calcium channel blockers like what amlodipine, verapamil, ranolazine can also help. Okay. Then ivabradine can also help. Okay. Then additional therapy could be what things drugs like what aspirin. Okay, you could bring drugs like clopidogrel, prasugrel, all of that could help. Then anticoagulants, you could what? Um, you could employ heparin. Okay, heparin could also help. Then statins can also help in that. All right. The non-pharmacological interventions include drugs like include things like what? Oxygen therapy, rest, relaxation, and cardiac rehabilitation. Okay. So guys, on that basis, that's it for what anti-anginal therapy for acute coronary syndrome.